I'm Kate Langbrook, host of Australia's #1 interview podcast for women, No Filter. Every single week, I get to sit across from someone, sometimes famous, sometimes completely unknown, and together we get to the part of the story nobody's heard before. And Mamma Mia subscribers get to hear it first. Every episode of No Filter drops 2 full days before regular listening, exclusive for subscribers. Plus, you get access to subscriber-exclusive episodes across the Mamma Mia network. Treat yourself to something worth listening to and get to hear it first. Tap the link in the show notes and become a Mamma Mia subscriber today.
You're listening to a Mamma Mia podcast.
Hello and welcome to Well, the podcast for your health and body explained. I'm Dr. Ginni Mansberg. I'm a GP. I mainly see women.
And I'm Cath Mahoney. I am a single mum, a comedian and a hypochondriac. So here is what we are discussing today. Haemorrhoids. That's a word we all love to hear, isn't it? Why we get them and what to do about them. The surprisingly common dilemma of hairy nipples and whether it's cause for concern. And in asking for a friend, your anonymous awkward health questions, we're talking about UTIs and gas. What a combo.
We're off to a rollicking start, Cath. I'm loving it already. But first, it's time for What the Health? Your quick dose of women's health headlines.
What the?
Oh, what the?
I don't understand.
What the health?
Ginny, give it to us straight.
Cath, I know you love all things woo-woo. I've got to ask, have you been ordering any peptides and jabbing yourself somewhere in the belly with a bit of a peptide?
No, absolutely not.
What? Why?
I know, because you're my friend and I know better.
Really?
Should I be getting onto them?
No, actually.
Okay, tell me.
Interesting. Very recently, the Medical Board of Australia, they actually issued a warning to doctors who are prescribing them, but also to the rest of us who are potentially consuming them, basically saying that, you know, the studies have not been done. The studies that have been done have been pretty iffy in terms of the results. We don't know where these things have been made. We don't even know if they have in them what they say on the tin because there's no regulation. You're risking all sorts of things for your health, and doctors who prescribe them, like, they're about to come down on us, not us, my colleagues, like a ton of bricks. But the thing is, they're really popular. I feel like my patients are telling me about them all the time.
So hang on, Ginny, can you give us a quick refresher? What are peptides?
Okay, peptides are kind of short chains of amino acids, which are the building blocks of proteins. So they're actually found naturally in your body and also in protein-rich foods. They help regulate your hormones, they support your immune system, they do promote tissue growth and even aid digestion.
So I've seen peptides in the shops, but they're like sachet peptides. So are they just using the word differently? You're just referring to like peptides that you inject?
Yeah, that you
Okay.
often get from China that say for research purposes only on the packet. But actually people are just going, that sounds good enough for me. If it's good enough for a monkey, it'll do me just fine.
No.
I'll chuck it in my belly.
I've got to say, the guy that does my eyebrows, he got on the peptides possibly from somewhere else. And he had a very bad reaction. So
Really?
so they're not for him. So he scared me off them. And obviously the fact that you're my friend made me know I just never order them.
A win for me.
A win for you. Not always, but today it's a win.
Cath, can we talk about something really weird that is happening to millennial women?
Absolutely. What have we got?
They are getting more shingles. So, you know, shingles that we all know about, we think about it's like an older person's condition. It's something that happens to like 70, 80-year-olds.
So what are shingles?
Shingles is a reactivation of a past chickenpox infection, and it causes a blistery rash, sometimes nerve pain and burning or tingling skin. Turns out it's cropping up in ridiculous numbers in millennial women. And so I'm guessing it's happening in Gen X women. Is it the stress? We don't even know what is going on there. Millennial women sort of are too young to get the shingles vaccine, you know, that has been out and about. Have you been hearing about the shingles vaccine?
No, talk to me. Shingles, because touch wood, I haven't had it. Is that like chickenpox but for older people? Or is that a myth?
Yeah, it is. So chickenpox is actually a herpes virus. So it actually never leaves your body, like all herpes viruses, and it just goes and lives in a nerve, ready to come out and jump at you from a dark place when you least expect it, often when your immune system's kind of misbehaving. So maybe you're sick, maybe you've had another virus, maybe your immune system's like misbehaving because you're elderly, but it seems to be happening more and more in younger people. There is a vaccine to tell your immune system to calm the farm and actually keep the shingles, the chickenpox virus in its box. Been reasonably effective, but then recently we had a change in the kind of shingles vaccine we've been using, one that gives you a bit more of a reaction to it, but quite a lot more effective for older people. They're seeing if we can bring the age down to 50 now instead of 55 because of this rising shingles cases in younger people. The thing that just blew my mind, did you see this in the paper, that it turns out that the shingles vaccine seems to really cut your risk of dementia right down? What the?
Wow. So why aren't we all having it?
Well, so the research was mostly done in the shingles vaccine that got displaced in Australia. So the old one that was not great at preventing shingles turned out to be great at preventing dementia. We've got to get the data that the new shingles vaccine has the same effect. Looking good. And for my money, prevent shingles, prevent Alzheimer's disease. Not entirely, just reduce your risk. Happy days. Just keep in mind that the research into its ability to prevent dementia is still emerging. I mean, the evidence is definitely still developing.
So should I be getting a shingles vaccine?
You know what, Cath? I think it's a personal decision, how much do you hate vaccines? But for me, I've just seen so many of my patients just get really, really sick. Takes them out of work. You and I are both self-employed.
Yeah.
If we don't work, we don't get paid.
Yeah.
So I did it. But I reckon everyone's going to make their own mind up.
All right, I'm putting it on my list. Okay, if you've been scrolling social media lately, you've probably seen people talking about morning rebounding. It's a trend of spending a few minutes bounding on a mini trampoline after waking up, with many people saying it helps them feel more awake and energised. Now, apparently you have to do this for 30 days. You don't have to have a trampoline, but should we be getting trampolines?
Oh, sure. Why not? Another thing to spend money on and take up room in your lounge room. I know, Cath, what have you got? You got the Stairmaster, also known as a clothes era. How many things have you got? Let's add a trampoline.
I've got no room for a trampoline. It would need to be a mini trampoline.
Well, these are mini trampolines. Can I tell you the evidence? It's not zero, but it's close to zero. Okay, so there was actually a study that reviewed 18 different papers on jumping, not on a trampoline, okay, just on the ground. And it did see very minor improvements in bone density. We're talking about 1.26% improvements in bone density from jumping not on a trampoline. I think all of those benefits would be undone by the fact that the
You're on trampoline
makes it easier. In terms of your mood, what if you just jumped up and down on the spot and saved your $200 on your trampoline and saved your lounge room from looking like a hoarder's palace? So I think that's a really good idea. So what I've read or seen on socials as well is people saying it's part of their exercise snacking, which we're all about, right? That if you can't get to the gym for an hour a day in your leggings, that you could grab 5 minutes here and there. It's just that this is not the best form of exercise snacking I've ever heard of. Number one, it's expensive. Number two, it takes up space. And I would rather, if you're going to jump up and down, just do it on the floor. Do some sit-ups, do some standing ab workouts. In fact, if you're on social media, there are so many women with their own 5-minute workouts that are standing on the floor with holding a can of baked beans. Way better money spent and way better for your exercise snacking routine.
Right, I'm doing that instead. Okay, up next, we need to talk about haemorrhoids, because whether you like it or not, there's a pretty good chance they'll make an appearance at some point.
How are you? Well, how are you feeling?
Are you well?
Are you well?
Moving on now to Are You Well? Okay, if you've got these, chances are you're not feeling your best. We're talking about haemorrhoids.
Woof.
Cath, so good to have you in the room because you do say it all like it is. When you gave birth to Lewis, did you birth a few little grapes as well?
No, but I had them when I was pregnant. I didn't have them so much afterwards, but I have popped a few back up in my time. So I need to check if that's the right thing to do or not.
Yeah, fine.
So I know what they are. For those listening, what are haemorrhoids?
So it's when parts of your veins, including all the tissues that support them, just get a little bit overfull and start pushing out through the anus. So they can be external. Sometimes you don't even feel them. They're internal.
How would you know that you've got a haemorrhoid, Dr. Ginni?
So you might just feel it there. Like you might just be like soaping your bum in the morning and just go, what the hell is that? There is a big lump there. And it might not feel like anything and happy days. But it might be an itchy or sore lump in your bottom that often freaks people out for the first time. They are very prone to bleeding because they nearly always contain a vein. So the bleeding tends to be drip, 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 drip after you've done a poo into the toilet. So it's not mixed in with your poo. It makes the toilet water go bright red. So not old blood, it's bright red blood. It's sometimes on the toilet paper as well. Can be a little bit itchy. And then after they've gone away, they often leave a bit of a calling card, which is like this quite a large skin tag hanging down where the hemorrhoid once was, a ghost of hemorrhoid past.
So why do hemorrhoids come on?
We don't know. Like there are lots of things that contribute to it. Genes, like if someone in your family. Yes.
Oh, I thought you meant denim jeans. I was like, well, I won't be wearing jeans again.
We'll just be wearing the corduroys. They're much better for the hemorrhoids.
Jeans with a G.
Jeans with a G. Like ask your mum, Mum, have you got hemorrhoids? This is a worthwhile chat to have, isn't it? Being constipated, anything that puts pressure on your veins is going to make that whole situation worse. Having a sit and scroll through the Game of Thrones or actually any other series while you're having a poo. Your poos have got to be in and out. You've got to be in and out of the toilet.
What? So how long? You're timing me on the toilet now?
I'm timing you on. I'm toilet timing. It's how people say like sitting on concrete will give you piles because piles hemorrhoids.
Is that true?
Yeah, no, that's not the thing. But it's a long sit on the toilet. I think it's because you like really relax your anal sphincter and you're just like there for anything that's going to come out. That in combination with the prolonged sitting is really linked to getting worse hemorrhoids.
Wow.
So like,
I love a long time on the toilet.
Do you?
I do my best thinking on there sometimes. Sometimes with my phone, must admit.
Okay, well, so
oh
now
my God, this is a no-no.
This is like,
this is a no-no.
Okay. No, Cath, we're going to have to go do thinking somewhere else. Okay, so we've said no to the trampoline. We've said no to the
denim jeans.
No to
yes
the
to denim jeans.
Yes to denim jeans, but no to the long thinking pooing combination.
Gosh.
That's just not happening. There are some people who get it like worse with certain foods.
Yeah.
I think that just like really makes the poo a bit more spicy and like sets everything off. But like if you do get them, sometimes they just go away on their own, happy days, but sometimes you do need to go and see the doctor because sometimes hemorrhoids come on because there's increased pressure from something nasty.
Okay.
So sometimes if it's a new onset of hemorrhoids with a new change in bowel habits, some new tummy pain, some new bloating, you might need to go and have a check with a specialist.
I was going to say, so how bad do things have to be around there to go to see the doctor?
So I think if it comes packaged up with some other bowel changes or some tummy changes, I think it's always good to get checked out. I also think that if it's so uncomfortable that you are not sitting down, it's interfering with your ability to like sit down and have a meal with your family or go to work or catch the train because it's just so uncomfortable down there, you need some help with that, right? Or if there's just bleeding all the time, like some people bleed a lot.
Yeah.
Like there's a lot of blood in the toilet. You can actually like lose a reasonable amount of blood.
Oh,
you
wow.
you want to see someone
Definitely
about that.
need to see someone then. Okay, so tell me the treatment options we've got.
Okay, so we do want to manage your constipation if you've got it. We went through all the pooey powders a couple of episodes ago. But on top of that, we do have like the high fiber diet, drinking enough water, yada, yada, yada. We're now going to undo all of your thinking time and say we're time limited on the toilet. You just can't go in there and watch 6 seasons of Game of Thrones. You're going to have to just limit. I think, you do your poo, you wipe your bum, you're out of there, no thinking. The next thing is you can, if it's really uncomfortable or itchy, you can have like a Zits bath, like just with some bicarb soda. That can often just make it feel a little bit better just temporarily and that might help. And then if none of that is working.
What about hemorrhoid cream?
Hemorrhoid cream.
And the things, the
suppositories.
Yes, the suppositories.
Yeah, they can be quite good for symptom relief, more for the itchy skin around it. They don't do that much to get rid of your hemorrhoids altogether. Okay. You can use a hemorrhoid cushion, especially if you can't sit down really well.
They look like a donut?
They do.
Donut?
They do take all your pressure off your anus.
Okay.
But if none of that is working or if it comes packaged with a side hustle of like a change in your tummy, like you're having some new bloating, some new pain, some new constipation, you're going to have to go to the doctor and get it checked out because don't want to have something yucky in there because anything that kind of blocks those veins, which could potentially be something nasty as well, that can make your hemorrhoids worse. So it is a bit of a warning sign. So literally most people with hemorrhoids have just got hemorrhoids because that's just really common. But all changes we just want to get run by a doctor. But then on top of that, there are some different procedures that we can use, everything from the old-fashioned banding them to the point where they fall off. There's some new injections that we can use. I know an injection in your bum sounds really bad, but it's not as bad as it sounds. And through to full-on surgery. It's just that the healing from that is difficult.
Okay.
Because it's an area it's hard to keep clean, let's be honest.
So if I have ever shoved one back up, was that the right or wrong thing to do?
No,
Just
that's
asking
totally
for a friend.
fine. Yeah, no, that's totally fine. And if that heals it, that's great.
Okay.
Sometimes being out can make it really a lot more painful and you can get quite a lot of relief from chucking it back up there. I just wouldn't, if it comes straight back out and it's really uncomfortable or any of the other things we've just talked about, then like off to the doc.
Okay, I wouldn't follow my advice, but it did help, yeah. Do hemorrhoids need to be removed?
No, most of them don't. Most of them, let's face it, most of us have them and we get on with our lives fine. If they're really worrying you, you can go and see a doctor and do something about them.
And ages, it can affect anyone?
It can. It's really common with people who are pregnant, like that around birth and pregnancy. It's really, really common around then. And then you get this second peak as you get older when constipation just gets so much more common.
Great. Another reason to get old. Okay, up next, how many hairs can you count on your nipples? Is that a rude question?
Moving on to our next Are You Well? We're talking about hairy nipples.
Okay, let's
Yay.
go.
Hair on nipples in women. Okay, it's not unusual, but I think a lot of women are really worried that what they have is like a forest and really unusual.
I'm just checking.
Yeah, can you feel them?
Well, I don't know, but I mean...
So do you want to know how to tell the difference?
Tell me the difference.
So vellus hairs, which is your downy stuff, often around on your cheeks and stuff like that, gets worse around perimenopause.
Yes.
But they're vellus hairs and they're kind of soft and
Say that
downy.
again, that sounds lovely.
Vellus hair. Sounds like velour, doesn't it?
Sounds nice. I could wear that.
Yeah.
I could wear that in a coat form.
Anyone who's got some spare vellus hair, Cath Mahoney is collecting.
I'm here.
Yes,
I'm here for
she's
that.
here for that. They normally are not pigmented. They're normally quite fair. They don't have what we call a core of compacted keratinocytes, which is the medulla of the hair. Oh,
Right.
how good. Which is like the
It's
hard...
like erotic fiction listening to this episode.
Do you want a moment?
Yes, maybe. Ooh.
So the core of compacted keratinocytes, which is the medulla, makes your hair quite hard. So these things are a bit soft and fluffy.
Yeah.
If you did have a breeze going, they'd be waving in the breeze like a lovely coat.
Yeah.
And they also don't tend to get erect when you've got that erectopili muscle, which actually makes your hair stand on end. They tend to just sort of lie flat in all conditions, in all temperatures. Whereas terminal hairs... That's like the bus terminus. They're longer, they're more rigid. They do have that core of compacted keratinocytes, keeping them nice and firm. They've got blunter tips. They penetrate deeper into the skin.
Jeez, you're really going for it with the description.
I
love this.
I know.
Penetrating,
This
okay.
is the penetrating black, hard hairs.
You know about these
You
bad
know
boys.
about these ones.
Yeah.
And it's like what we look at when we're worried about like too many nipple hairs, which are, let's face it, mostly genetic.
Yeah.
Mostly genetic. We do look to whether they are a lot of vellus hairs, which are pretty normal, or whether you've now started getting a whole lot of terminal hairs that are the pubic hairs, the black ones.
So what does that indicate?
Well, it can be a lot of androgen, male hormone. It also can be really sensitive hair follicles, so real sensitivity to the androgen. So some women have got normal amount of testosterone in their blood, but they're just really, really sensitive, and that does tend to be genetic.
Okay.
But if you have a high level of androgen, it's our old friend PMOS, polyendocrine metabolic ovarian syndrome, used to be called PCOS, making an unwelcome appearance around your areola, which is the nipple's only the small bit.
Yeah, it's just a little bit in the middle, isn't it?
The brown bit around the outside, that's your areola. That's the bit that the baby has to latch onto to really get a good suck. You don't tend to get hairs on your nipples. They tend mostly to be around the areola.
Okay.
Yeah. So if you're getting those And it comes with a side serving of irregular periods, maybe more sweaty, maybe some acne, maybe some thinning of your hair on your head. Then we're starting to think, could you have a polyendocrine metabolic syndrome? A lot of girls who have that, but not all, are overweight. They really struggle to lose weight quite a lot. And they feel like, well, I don't eat that badly, but why is my weight so hard to shift? And with that, we really need to get you to the doctor. The hair itself, you can go get that removed with, you can get some laser.
You can get laser on your boobs?
You can.
Okay.
It does seek out pigment.
Yeah.
So the best thing is if you've got a slightly paler areola and dark hairs, it does much better with that. Otherwise, you can get electrolysis. Some women find that really uncomfortable around that area. It's very sensitive.
Yeah.
If you pluck them, it's okay. It's just sometimes they can actually get ingrown hairs because those hair, it can get ingrown and then they can just get a bit nasty. You can get some scarring, some pigmentation around that area. But if you don't have too many of them, you could just try plucking them if that's what you wanted to do. The bigger issue is why is it happening and what do we need to do to stop that from happening, because that endocrine disorder does predispose you to diabetes, earlier onset of heart disease, even things like dementia, some cancer. So we've got to be really strict with your diet, really strict with your exercise. In some cases, you need a medication to actually just get your hormones under control.
So it is actually, for anyone listening out there that has noticed more hair growth there, it is actually something to go and see a doctor about.
Particularly if you also have acne, irregular cycles, you're starting to lose some hair. If you're starting to grow hair in other areas, the chin, around your neck, the underside of your chin, underside of your jaw. Hormonal acne tends to be on the lower third of your face, not so much the T-zones. So around your jawline, acne, and they do tend to be those big cystic whoppers around that area. If you're getting those, it could be a sign that your hormones are a problem. Please go and see your GP.
Okay. Up next, asking for a friend. What do we do when we've got frequent UTIs and when you just can't stop farting?
I'm just asking for a friend.
So my friends, they want to know.
It's not for me.
Hashtag just asking for a friend.
Okay, it's time for my favourite, asking for a friend. Awkward, anonymous health questions that we know aren't actually about your friend, but we pretend they are anyway. Today's question comes from an anonymous listener. I'm going to read it out. Hi, Ginni and Cath. I'm 31 and I've started getting frequent UTIs over the past year, even though I've never really had them before. They're becoming really frustrating and seem to keep coming back after treatment. Is there usually an underlying reason this starts happening? And what can I do to reduce the chances of getting another one?
Yeah, Anonymous, I am worried a little bit about this. I think it's underdiagnosed. So what we know definitionally is that if you have 2 or more urine infections in a 6-month period.
So UTI is a urine infection.
Urinary tract infection.
Yes.
Yes. Which is like you're burning and stinging and not always just down there. Sometimes it's in your bladder. Like it can feel like a cramp, like from period pain. Often you feel like you need to wee, get to the toilet, a dribble comes out.
Yeah.
You leave the bathroom, 10 minutes later you've got to go back in. You just feel like you're weeing all the time.
Okay.
Sometimes blood comes straight out. Like you can, whenever I get urinary tract infections, I just pee blood.
Oh, wow.
And the other thing just to remember is that older women, so women perimenopause and older, often don't have the peeing frequently. They don't have the burning and stinging. They have a bit of feeling off, feeling sick, maybe a bit of cramping, and you're only going to notice it because your urine stinks. It's full of bacteria, so it's really, really smelly.
Wow.
And so I have so many women in their 50s and 60s and 70s who just do not pick it because they're waiting for the burning and stinging they used to get in their 20s and 30s. Just disappears. Doesn't look like that anymore.
Wow.
If that is happening more than twice or 2 or more times in a 6-month period or 3 or more times in a 1-year period, we call that a recurrent urinary tract infection, and we've got to see what the hell is going on.
Okay.
Because having a one-off here and there, okay, we'll give you a leave pass. But if it's happening all the time, we do need to look into what is going on. And that's when you really need to go and see your GP. So your GP is going to start by going, okay, is there something inside your urinary tract that's actually drawing bacteria in? So, for example, a kidney stone. You don't know you've got it. Kidney stones love bacteria. bacteria love to just go and sit inside them, and then just like every now and then send an ambassador down to your down to your bladder to actually give it some curry. So I can't tell you how often we find a kidney stone that is the cause of all of this. Severe constipation that literally blocks the outflow of your bladder that actually can contribute to recurrent urinary tract infections, prolapse, things like that. So we actually do need to go and not only diagnose it, but then treat it as well. And there are lots of treatments for recurrent urinary tract infections that we would not give you if you've just had a one-off. But if you're getting them all the time, you're definitely going to want to know what is going on here.
So I always thought a UTI was from having too much sex. Is that not true?
The old honeymoon cystitis.
Yes.
Yeah, look, it's definitely a cause, particularly of one-off ones, because let's be honest, the guy often he doesn't go straight into the vagina, and sometimes it's made a little whistle stop over at the anus, accidentally bumped into the wrong spot. Guys, by the way, if you're ever intentionally having anal sex, can you not go anus straight into the vagina? That is asking for a problem.
Oh, so that's a real UTI.
That's a
right
real
there.
UTI
Okay,
right there.
okay.
Like, so if you're going to do anal sex, let him finish there.
Yeah.
Start somewhere else or change condoms.
So that is enough to start a UTI?
Yes, it
Okay.
is, particularly if everything's a bit rigorous. And particularly if it's like maybe a new relationship and
Yes.
you're not warmed up enough.
Yeah.
Or particularly if you don't have a lot of estrogen down there. So if you're in
Okay.
the like perimenopause or after menopause, that sort of thing happens really, really commonly. But after a while, like that's not going to happen anymore. Things sort of settle down. My concern actually is the women who go and get a script from like Dial a Script, one of
Yes.
those kind of services, or they've got a really good relationship with their pharmacist, so they just go and pick up the antibiotics and no one's done a test. And so we're not actually diagnosing the recurrent UTI, or they've gone to a medical centre, not their regular GP, so no one's keeping track of exactly how many you have. So we're not in a position to diagnose it or treat it.
So any more than 2
In a 6-month period.
in a 6-month period,
2 or more.
2 or more is recurrent, and you really need to speak to your GP about this.
Or 3 in a 12-month period.
Okay.
So
That's not a lot.
no. So we're going to try and diagnose you, try and find out what is going on, and then we're going to try and treat you. So the treatments that we have, there's actually quite a few things that we can give you to change the microbiome in your bladder. We can actually use low-dose antibiotics. They actually work quite well. If you are breastfeeding or if you're perimenopausal or postmenopausal, we can give you some vaginal estrogen.
Okay.
It can be really effective in preventing recurrent urinary tract infection. And that can potentially be life-saving because we know that urine infections don't always stick around in the bladder. Sometimes they make an escape and they actually go travelling up the tube called the ureter and go into the kidney. And from there, it's a hop, skip and a jump into your bloodstream where it can actually do terrible things. Like people die of urine infections.
Oh, gosh.
Particularly if your immune system is not good. Like for a really healthy 20-year-old, you're
Yeah.
probably fine. And Anonymous is 31.
Yeah.
She's likely to be healthy. But we just don't want to muck around with this stuff. Let's just get it sorted. So, yes, Anonymous, stick to the same GP every single time. This is exactly why. Make sure that if you think you've got a bladder infection, tell the receptionist it's urgent. I've got a bladder infection. She told me I have to keep coming back to her, not go to the medical centre. Or if you do have the medical centre situation happening, make sure that they copy in your GP and send them a letter about what's just happened so that you don't get the situation of you falling between the cracks and you end up writing to Cath and I.
Sounds like a good idea to me. What about cranberry juice, just to finish, or is that a no wives' tale?
No, there is a little bit of evidence for cranberry tablets. The cranberry juice is full of sugar, and if you do have diabetes, which, oh, by the way, is another cause of recurrent urinary tract infection, because if you don't have well-controlled diabetes and there's lots of sugar in your bladder, bacteria just go, woo, I'm swimming in this. This is so much fun for me. We don't want to do anything that's potentially going to contribute to diabetes. So our preference is cranberry tablets to cranberry juice.
Okay.
Little bit of evidence. Mainly probably changes the microbiome in the bladder, which is not a bad thing to do, but talk to your GP. Don't go and diagnose yourself and manage this yourself. This is something you need to do with a professional because we need that diagnosis piece first.
All right, our next one comes from Joanna, who's in her early 40s.
this is a little awkward, but I have started passing wind a lot more than I ever used to. It seems to happen at the worst possible times too. Like I'll be in a work meeting, or like the other day I was in a yoga class, and also even at the supermarket. Is this just something that comes with getting older, or like could this be a sign that something in my diet or gut health needs my attention?
Ginny, this actually could be from me. It is not, but I am very much identifying as Joanna.
Yes, I think
Except I'm
so many of
51.
us do. And Joanna, thank you for actually like sending us a voice note and not even asking for a friend.
Yeah.
She's so brave, and we love you. Joanna, I think if this has been going on for a while, I think you need to go and see your doctor. Because it could just be like you've suddenly developed lactose intolerance. Mm-hmm. It does happen sometimes. Mm-hmm. Maybe you've got a bit of irritable bowel syndrome. Maybe you've picked celiac disease up in later life. But whenever there's a change, I just like you to go and get checked. I want someone to have a feel of your belly, ask a few probing questions, and possibly send you off to a specialist to have a look up there. Because, you know, when you're in your early 40s, I've always just got something yucky in the back of my mind. Chances are this is just going to go away and everything will be fine. Let me tell you some of the big culprits that I see. Cath, Mahoney, do you have protein powder?
Yes.
Big culprit. They often have fake sugars in them, and fake sugars are notorious for like changing your microbiome. They draw all sorts of gases and fluids into your guts and actually can make your poo smell horrible. Weight loss shakes are another huge culprit.
Okay.
Some like new supplements, when you start a new supplement, they can actually change the gas pattern that's happening to you. Don't forget, your gas is made by your bacteria. Most bacteria have very, very little smell, but they're just a couple that are just the culprits, and they all of a sudden they can smell absolutely disgusting, and they come in for no rhyme or reason. I was at a function the other day, and I was thinking, are we near a sewer plant? I just can't.
Yeah.
This just absolutely smells dreadful near here. And then all of a sudden I realised that like somebody was just letting rip some SBDs, some silent but deadlies.
I was on a plane the other day and I was like, I wanted to tap him on the shoulder and go, I can smell that. And my hair's curlier than usual. Please stop.
And on a plane, they've got pretty good filtration. You good thing.
Literally, it burnt my nostril hairs. You know, listen, I've had those moments too. I'm not saying, you know, that mine smell like roses, but yeah. Also, how much wind is normal? Asking for a friend, aka your friend, me.
So I'm glad it's you, because some of our friends that we know very well are going to claim it's 0 mils a day, which I say call the ambulance. That's called a bowel obstruction. Yeah. So normal is somewhere between half a litre and about 1.5 litres a day of gas. About 700 mils is sort of average. Going over about 14 to sort of 20 farts a day is sort of average.
It's average.
And that is mostly coming out at night. Have you ever slept next to somebody who's accidentally let out a banger, and you're just lying there going, whoa.
I remember waking up my ex-husband once with one. It was me.
Was it loud?
God bless him. Woke him up. So yeah, it's very loud. Marriage
love
was
that
doomed
for you.
from that moment.
Wow, another awesome episode. I love this with you, Cath.
Me too.
So
Me
good.
too.
But that is it from us. Don't forget to follow the show. We love all of our followers. And if you do that, you're never going to miss an episode. It's going to drop straight into your feed automatically. How good. And if you're feeling nice, and who's not, because our well listeners are so nice, can you please leave us a rating and a review? Only a good one, please. If you've got a bad review, yeah.
Please don't leave one.
Yeah, just and you can leave that on either Apple or Spotify.
And if you want to hear your asking for a friend question,
yes.
send us an email or a voice note to well@mamamia.com.au, and we, when I say we, I mean Dr. Ginni, will get to the bottom of it. Literally, as we just did. And please remember, information discussed in this podcast is for education purposes only and is not intended to provide professional medical advice. Please seek your own medical advice specific to your circumstances from your healthcare professional. See you next time.
Stay well.
Mamma Mia acknowledges the traditional owners of the land we've recorded this podcast on, the Gadigal people of the Eora Nation and the Wanneroo people. We pay our respects to their elders past and present and extend that respect to all Aboriginal and Torres Strait Islander cultures.